Thank you so much. Thank you, Sue, for the lovely introduction and for inviting me to speak this evening. Over the last 10 years, I've been working as a community midwife and studying for my PhD at the University of Leeds, which I completed in 2021. And as you say, I teach for the NCT as an antenatal teacher, and I've done that since before qualifying as a midwife. And throughout my work as a midwife and an antenatal teacher, I've had an interest in the experiences of fathers and partners. So the terminology for our session today, my PhD research looked at communication between midwives and fathers, but the findings may apply to same-sex partners, other family configurations, and all birth companions. And during this presentation, the midwife is female, as all the midwives were in my study, but I'm aware that midwives also can be male. So why did I choose to focus on fathers rather than same-sex partners, say, or mothers who are birth supporters or other birth companions? Well, from a historical point of view, childbirth has been women's business until really very recently. It's only in the last 60 or 70 years in the UK that fathers have been allowed, in inverted commas, to be present. Indeed, in the 1950s, we know that even when a baby was born at home, fathers were quite often excluded from their own bedroom where their partner, their wife, was labouring, which seems quite incredible now that somebody wouldn't be allowed to go into a room in their own house. And the research that's grown over the last 20 or 30 years on fathers' involvement and experiences and the roles they play during childbirth, as I say, has grown exponentially, but most of it, from my literature search, concluded by saying, yeah, fathers may have these experiences which may be traumatic, as Mark's referred to in his presentation just now, and they conclude by saying the midwife's the person who's best placed to address the needs of the father. I'll just tell you a little bit about how I went about my research before going on to some of the findings. The research question was, how do midwives and fathers communicate during labour and birth? And I used an ethnographic approach, which involved collecting my data through direct observations during labour and birth. And while I was observing as a non-participant, I made notes of what was occurring in terms of communication between the midwife and the father, and also drew some sketches which showed where people were placed in the room, which were very interesting and enlightening. And I'll share some of the findings in this presentation. So I recruited parents during pregnancy, and 11 couples took part in my study. All the women had vaginal births. 3 were assisted with forceps or Ventouse, but all the babies were born vaginally. And the parents, there were 4 first-time parents, 4 second-time, 2 third-time, and 1 fifth baby. And the babies were born in a range of different birth environments. 5 were born in delivery suite, and 2 in maternity theatre. 2 were born in a birth centre, and 2 were born at home. And then after I collected my data in the field, so being present during the labour and birth, I then interviewed the couples and the midwives who looked after them. And I spent a considerable amount of time before I started collecting my data in the maternity unit, making sure that all of the midwives who worked there were aware of the study, aware of what they might be invited to participate in, and obviously their right to decide not to participate. So to analyse my data, I used thematic analysis, and you can just run on, please, and we'll have all the 5 key groups of findings there. The first were about findings about the midwife-father relationship, the second about how differently fathers and midwives experience the landscape of childbirth. I had some very interesting findings about how different the midwife-father relationship is in different birth environments, and I'm going to talk a bit about that this evening. There were also a group of findings about midwives and fathers' expectations of themselves and each other, and about the birth triad, that's the mother, the father, and the midwife, and its potential for sharing knowledge. So today I'm going to focus on 3 issues from my research. The first is the nature of midwife-father communications, the second, the impact of birth environment, and the third, how we as midwives and other maternity workers can help fathers and other birth supporters to habituate within an environment which may be familiar to us, but is nearly always unfamiliar to fathers. So the midwife-father relationship, and this may seem like stating the obvious, but I think it's really worth saying, it is based solely on communication. That's the entirety of the relationship between the midwife and the father. The midwife's relationship with the mother has communication as a very important component, but there are also other clinical aspects of care and responsibility within the midwife's relationship with the mother. With the father, communication is the entirety of the relationship, and that's why it's so important. So what I found in my research was that non-verbal communications are the foundation of the midwife-father relationship, and this quite surprised me. There were some verbal elements in the relationship, which I've described as chat, banter. Those are the ways in which we as midwives seek to build rapport. So, for example, I witnessed midwives talking to the father about whether did he know what gender the baby was, had they thought about names and so on. And it was sort of quite light-hearted social chat. I also observed midwives giving fathers information and explanation, and also giving information and teaching to student midwives, which was witnessed and absorbed by the father. In the hospital environment, it was almost always initiated by the midwife. So the father would be watching and listening intently to everything that was going on. He'd be looking at the expressions on the midwife's face. He'd be watching attentively as if anybody else came in and out of the room, what they were doing. He'd be glancing around the room at the equipment and maybe things that were unfamiliar, like the resuscitator, but not asking questions. But he'd be listening very intently to what the midwife was saying. And sometimes, if the midwife was talking to the mother and giving words of encouragement, he'd be copying what the midwife was saying. And what he seemed to be doing was working hard to make sense of a very unfamiliar situation. And there was a lot of guesswork and assumption going on rather than him asking questions. So there seemed to be some inhibition on initiating conversation in the hospital environment. And this is a midwife Lynn, in her interview, talking about how she worked to establish rapport. You go in and introduce yourself and kind of get a feel for the family environment that you're coming across, and then just tentatively try and guess what they want from you and build a relationship that way. I don't quite know, actually. I've never thought about it really. So Midwife Lynn was saying she hadn't thought about how she did that rapport building and getting to know the father, but she does say she was trying to guess what the parents wanted from her. I've chosen an extract from an interview with a father here, Ricky, having their first baby. they were at this point labouring at home. They were planning to have a home birth, and Ricky said in the interview after the baby was born, it felt like they were concerned that it was going on too long and there might be a problem. They didn't communicate that to me. That's just what I picked up from sort of body language. So he's trying to interpret what was going on. So a bit of guesswork on his part as well. Yes, next slide, please. And this is another father, Donald, having their second baby, describing in the interview how he was sensing what was going on. This sense, I suppose, their demeanour was quite calming as well. The way they communicated with each other was quite reassuring. The midwives might not be very pleased to read this description of themselves, but Donald found it very reassuring. You could tell they'd been round the block. They'd probably been there at hundreds of births, and that for him gave him a feeling of security. And this is, again, fathers picking up what's going on. So as I've said, what I observed was the father being really struck dumb, particularly in the hospital environment, listening attentively, may mimic the midwife, scanning the environment. I noted in a field note the father's eyes, Jack, this is the father Jack, his eyes were darting about. This was during some complications in his partner's labour, and he was clearly trying to sort of figure out what was going on, rarely asking a direct question, waiting to be addressed, apart from in the home environment where I observed quite significant differences. So I've put a picture of a plane there because it struck me quite early on in my observations that it was a bit like being on a flight. In the hospital environment, the father is confined. Years and years ago, we used to talk about mothers confinement and home confinements, and I guess there's echoes of that in this. I felt that the fathers were confined in hospital, like being on a flight, except they didn't know whether they were flying, I don't know, to Barcelona or going to Perth in Australia. So is this a short flight or a long flight? There's absolutely no idea. They don't know where they're going, and they're not sure what their role is, so they're trying to figure it out. But the comparison with being on a flight is that you're in a bit of an unfamiliar environment. You're in a very restricted place. There's limits and restrictions on what you can do, and you can't leave. I observe fathers feeling reluctant to leave and take a break in the hospital environment, and often needing permission to leave. They were apprehensive about leaving, and I think apprehensive about gaining access back into the birth environment. Now, the differences at home were really interesting. In my study, three of the couples planned to have a home birth, and two of the babies were born at home. So I had the opportunity to observe and make comparisons between how midwife-father communication worked at home compared to hospital. At home, the father had the freedom and autonomy to move in and out of the birth environment. And in fact, particularly, I'm thinking about one labour. This was second baby, the first baby being born in hospital. The father was actually not in the room with the woman while she was labouring for most of the labour until she moved into transition and then into second stage, and then he stayed by her side. But he was available to her if she'd wanted him. The mum was called Lou, and her partner was called Donald, and Donald was occupied with what I called legitimate tasks. He was making cups of tea for people, he was sorting out washing, he was heating up some soup, he was doing sorting out the childcare for their other child. So he had lots of sort of valid, legitimate tasks, which fathers don't have in hospital. They have nowhere to go apart from staying with the woman in labour. And this led me to think, you know, if given the choice, would for some couples, perhaps the father wouldn't be by her side all the time, and perhaps that puts pressure on the mother as well, because actually Lou said in her post-birth interview that this experience of birth at home had been better for her because she wasn't worried about how her partner Donal was coping with being in the same room for 12 hours and not having much to do. And she said, I shouldn't be worried about him in labour. And I'm sure we agree she's absolutely right. So this is a slide showing the continuum of familiarity for the father in the different birth environments that were involved for the couples in my study. Obviously, home is the most familiar environment. Birth centre with less medical equipment visible, hospital delivery suite and maternity theatre being the most unfamiliar environment for most fathers. And this definitely had an impact on how easy and relaxed the fathers were in their communication with the midwife and how comfortable they felt in initiating communication with the midwife. So in maternity theatre, the least familiar environment, where there may be an element of emergency and urgency around the baby being born, the couple may land up in maternity theatre, as the couples in my study did, the two couples who went to theatre after many hours of labour. So both parents were really exhausted, and then they were transferring to another new environment. And for one of the couples, they transferred from home to a birth centre, to delivery suite, and then to theatre. So they both, and both partners, the mother and the father, had to orientate to these different environments. But what I noticed is the father's state of alert attention really went up and up with each transfer of birth environment. And also in theatre, one birth companion was allowed, and for couples who've had additional birth supporters like a mum or a sister present, that's really deprivation for the father of the person who's been there partly for his support. Before going into theatre itself, there was a period of separation from their partner while she went into the anaesthetic room before going into theatre. So that was a time of acute anxiety. And once in theatre, the midwife's attention was really focused on the mother, and the least familiar environment for the father, and he had the least support from the midwife because she wasn't able to give him the support because her attention was so much on the mother. And the result was that the father's levels of anxiety and his visible distress increased, and he also reported in post-birth interviews how stressful that time was. So how can we help fathers to habituate? I think it can be really valuable for us as midwives and workers in maternity care to think about our own first experience of childbirth and how did we feel? That whole mix of emotions, the excitement, the strangeness, the unfamiliarity, because as we go on and grow in experience as midwives, we can lose touch with what the perspective is for those who are experiencing birth for the first time. And particularly, we're focusing on fathers here. So for us, through our training, our education, our clinical experience, through our lives as midwives, childbirth becomes very familiar. For the father, even a father who's been present at several labours and births before, birth is still an extraordinary experience. So I hope that through sharing some findings from my research, I've kind of opened the door a bit on the father's perspective of childbirth. I was really struck by this comment at the top of this slide. This was Mick, were having their third baby, talking about his first experience of childbirth. He said, you just have to get through it. And there's another quote here from Ricky, father of a first baby, describing his experience of labour, one of his vivid memories. The other thing I vividly remember is almost all the way through, Jo's breathing was, exhaling in pain. And when she had the gas and air, it just made it sound so horrible. So like and he gave a demonstration with a high, long exclamation of pain, but through a tube. So it sounded like more metallic. And I just remember thinking, you've been in pain for so long and you were just shattered. And I was really struck by this comment because how many of us, we're so used to hearing women breathing gas and air. I was so shocked by his perception of what for us is the normal and the everyday, and for him was just extraordinary and really stressful. This is just a reminder to us, don't assume anything. Because I think one of the findings from my research was that midwives tended to think if a father was having, if it was a second or subsequent baby, they had experience and they didn't need explanations in the same way. And this is Darren, a father, saying, even though it's your second, you still haven't a clue because it's completely different experience because of the fact it was so different. For the first labour, there'd been lots and lots of intervention, lots of people in the room, lots of equipment. The second labour was just the parents and the midwife, and he found that very different. Something that fathers would really like us to do is some thinking out loud, even when from a midwifery point of view, everything is normal and going as we'd hope, in a straightforward way. And this was a father's comment in interview. I was pretty sure Shona, the midwife, had already made her mind up a couple of minutes in advance as to what was probably going to occur next. And he would have liked her to kind of say it out loud. Just some reflections from my point of view as an experienced midwife, but a new researcher when I started on my PhD ethnographic research. It was such a privilege to be present during labour and birth without clinical responsibility, and to be able to really pay attention to what the father was experiencing. It helped me to see with fresh eyes. And next slide, please. I have some questions for us to think about. I'm just aware of time here and we may not have very long for discussion. But here are some thoughts. How can we encourage fathers to ask questions? How can we discover and negotiate the roles that the couple wish the father to play? What can we learn from the ease of communication at home births? And how can we help fathers to habituate to what is an extraordinary experience in their lives? And there are my contact details and just a link to my thesis and a beautiful picture.